David Dillard, Sleep and Science Centers. I'd like to talk a little bit about sleep apnea and headaches. Sleep apnea and headaches are a very common complaint. Sleep apnea, um, typically speaking, is associated with snoring. Um, there are other types that don't necessarily snore, but when you are waking up tired, fatigued, constantly dragging, easily taking naps, if you're taking a nap on a regular basis, you should look up sleep apnea. And then there's a test that you can take. It's on our website as well, but the test that you need to look into is called the Epworth test, um, Epworth Sleepiness Scale, which was named for the hospital that it was discovered. This was a reasonably valid test to discuss with patients, and it was reproducible pretty regularly. Um, the gist of this is that the people who have sleep apnea are pausing the respirations at night. They stop breathing. Apnea literally means no breath in Greek, and it just sounds better. It's shorter, so we use Greek to make that happen. So the apnea that you're looking at for most people is obstructive. It means that you're obstructing the airway. Your tongue is usually the biggest player in that role, along with the epiglottis and some other structures in the back that are usually associated with swallowing, and they cause problems. So these are some topics that you can need to look in and discuss with your doctor. And obviously, it's something you can't diagnose on your own. But if you're having witnessed apneas, meaning somebody's seen you breathe at night and you stop breathing, it needs to be evaluated, period. So they typically will have, those patients who have this will typically have early morning headaches. And these headaches can be everything from one side excruciating headaches that run back and frequent migraines to just kind of dull, blah headaches. But if you're having regular headaches, you don't have a diagnosis, and you are tired and fatigued all the time, it is a thing that could very well be helpful for you to check into. Now, if you look at the percentage of patients who have sleep apnea in the United States, you're looking at a very large group of people. You're talking about people that are over 50, probably have almost a 50% probability of having it as you age. That whole population over 50, it's one out of every two ish, and it's not exactly straight numbers, but without making it too complicated, almost every other person that walks around has got sleep apnea. So check with the people that you're around, ask them if you snore loudly, go look up the Epworth, talk to them and ask them specifically, do I stop breathing? Now, even if you aren't noticed to stop breathing and you're tired and you're fatigued and have all the other symptoms, especially if you have blood pressure problems and cholesterol and diabetes, those symptoms tend to suggest that you should be checking these things out with your doctor. And the only way to check it is a test. And if you think you have it, you should check it. So, hope this helps, and we'll talk to you soon.